Hello and welcome to It's Your Case, brought to you by VetCT.com. I'm Lucy Meehan, I'm your radiologist on demand for this case. Today we have a 2-year-old standardbred gelding who is presented with bilateral stifle effusion. Once you've reviewed the radiographs using your systematic approach, you're ready to watch this video. So I'm going to go through the salient points of the report and point out some areas that of interest on the radiographs and some normal things. We're going to start with the right stifle and then we'll move on and quickly look at the left. So just to tell you what views that we've got up here, we have a lateromedial view on the left, a caudolateral craniomedial oblique view in the centre, and then a caudocranial view on the right. And this is what I would determine as a minimum sequence series for looking at a stifle. If we just have a look at the anatomy, we can see that this here that's poking out more is the medial trochlear ridge of the femur. Remember that the medial trochlear ridge has an important part to play in the passive stay apparatus, and that protrudes further than the lateral trochlear ridge. The lateral trochlear ridge, which is this one. You can tell this is a lateromedial because your femoral condyles are nicely superimposed. This is our caudolateral craniomedial oblique, so we've got the femoral condyles are not nicely superimposed on one another, and you can see that the lateral trochlear ridge has been projected cranially and is in line with the medial trochlear ridge. The reason we take this view is to enable us to examine the lateral trochlear ridge in slightly more detail, and then the caudocranial view is fairly standard. The physes are open, so this is the distal femoral physis and the proximal tibial physis. That's perfectly normal in a horse of this age. This here is our fibula, and this radiolucent line is perfectly normal. That's a separate centre of ossification, so not to panic about that. So if we start by looking at our soft tissues, you can see we've got a slight dorsal bowing of the soft tissue, cranial bowing of the soft tissue margin cranially. That's consistent with a mild femoropatellar joint effusion, and I would comment on that. If we just make the lateromedial view larger, we can see that we've got our nice medial trochlear ridge here, and if we just look at our lateral trochlear ridge, we can see it's quite flat, and we've just got this little mineralized region, so linear mineralized opacity just dorsal to it. So that would raise some alarm bells with me with regard to this lateral trochlear ridge. So I want to take a better look at the lateral trochlear ridge. So I'm going to look at my caudolateral craniomedial oblique, which is projecting my lateral trochlear ridge cranially, and you can see as this is overlying, we've got a little divot just here in our lateral trochlear ridge and another one just here where the medial trochlear ridge crosses that, and we've got some sclerosis or some increased radiopacity just on the caudal aspect of those divots. So that to me would indicate we've got a osteochondritis dissecans lesion of our lateral trochlear ridge of the femur, and we've got a discrete mineralized fragment which is here just associated with that. So we've got OCD of our lateral trochlear ridge of the femur. We've also got a femoropatellar joint effusion, which I think are the main salient points in this case. If we look at our caudolateral craniomedial oblique, you can actually see the osseous fragment just here. Why we're looking at the caudocranial? Well, when we look at the caudocranial, it's always nice to see the medial femoral condyle and just examine that closely, because that's quite a common place for osseous cyst-like lesions, and those can go hand in hand with OCD lesions, so that's quite a good thing to look at as well. So this horse has certainly right stifle OCD, and we always would x-ray both because OCD can be a bilateral disease. So let's get the left stifle up and just see what we've got there. So I think the changes in the left stifle are present, but I think they're much more subtle. I think the first thing that I would say is that our cranial soft tissue swelling is actually greater in the left than the right. If we just make this bigger, we can see there is just a little bit of irregularity just here on the lateral trochlear ridge, but it's quite subtle. If we examine our caudolateral craniomedial oblique, we can just see there is a shallow defect just here in the lateral trochlear ridge. So I can't see a separate osseous fragment, but I can see a defect. You don't always have to have a separate osseous fragment. The fragment can be cartilage. So I would say that this horse has bilateral osteochondritis dissecans of the lateral trochlear ridge. Again, our medial femoral condyle is normal. So I hope that has answered any questions that you have for that case. Do remember, if you have any other questions, it is your case. Please don't hesitate to ask them on social media. Thank you very much for listening.